Okay, well, thank you. I'm really excited to do this. I love, the best part of my job is talking to parents about their kids. I truly enjoy it. I've been practicing out at Creighton for 12 years. I actually see one of my parents here, so I'm so excited too. So this will be even double bonus. So I was just reading the top line there, advanced training for the hardest job of your life, and I was thinking to myself, wow, that is so true. And how many of you here have one child, or your toddler is your one child? Okay, so it kind of makes a difference because, you know, sometimes when it's your first time going through as opposed to your second time going through, there is a little bit of a difference. And so when I do instruction for parents, I kind of know whether they're first-time parent or second-time parent and what they can handle and what they can't handle. And so some of this is going to be directed towards first-time parents, some it's going to be intermixed. But I tell parents when they deliver their first baby, I'll say, welcome to parenthood. It's the toughest job you'll ever do, but so worth it. And I say that knowing that I went through medical school, I went through residency, my wife went through medical school, she went through residency, so I've been a spouse of doing that. We have twins, we had 4 kids, 3 and under, and having that first child was still the toughest thing I've ever done in my life. And I was a pediatrician going through it. So think about that when you're frustrated or you're just like, I don't know if I can do this. Oh, that guy, he had 6 kids and he was a pediatrician and he still said it was the toughest thing he ever did, okay? So as I'm talking to you today, I want you to understand some of it I'm going to tell you. This is what the AAP said. The AAP is the American Academy of Pediatrics. This is what they recommend. But I'm also going to give you the practical. Hey, this is the dad talking. I've done this before. This is more practical speaking. So I'm going to give you the right way to do it, and I'm going to tell you some practical advice along with it, okay? So you'll be like, well, I can't find that in the book. I'll be honestly, I'll tell parents, I'll be like, I'm not talking as a pediatrician, I'm talking as a father now. This is kind of what we did, okay? And so we'll kind of talk a little bit about that too as we go along. Okay, so the first thing is the proof. Here's the proof. Here's the 6 of them. So we got 11, we've got 6, we've got 5, we've got 6, so the twin boys. We've got 8, and we've got the toddler, the 2.5-year-old. And I'll tell you what, the 6th one is trying my patience quite a bit, and I've done it with 5 other ones, and I'm still struggling with my toddler to implement the things we're going to talk about. So, and again, it's easier, a lot of this is easier said. It's easy for me to say to do this. It's sometimes hard to put it into effect, okay? But keep trying at it. Okay. So the first thing we're going to talk about basically is the milestones. What should your kid do? I mean, everybody wants, especially the first kids, they're always like, he should be doing this by this time. The big milestone is, my kid's 12 months and he's not walking. My kid is this age, they should be doing this. When are they going to do this? And that's great. I remember with my first one, I'm like, oh, he's 4 months, he's not rolling over. He has autism, I'm really worried. And that's no joke. I came in and he was 4 months and he wasn't rolling. In residency, I learned by 4 months they should roll at least from front to back. And so then as a practical parent and as a more advanced pediatrician, I realized that these come in waves. I mean, every baby is not going to do these the same. And as pediatricians, we know when it's the, quote, telltale sign of concern. And for the toddler, the biggest one is speech. And different pediatricians and family practitioners have different, different tolerance for what they allow as normal. For instance, my kids were not early talkers, so I'm more laid back on if it's a first-time child, if it's a male, if it's a child who understands well, if it's a bilingual family, I'm not worrying you about their talking. However, some people are really concerned about a child's verbal skills. And so that's something you need to feel comfortable with your provider because there is a wide range of what can be normal. So some of the ones you can read is walking up and down stairs, kicking and throwing a ball, jumping and climbing. And, you know, I hardly get questions about these. These most kids are doing. These aren't usually questions that come up. It's the ones we talked about, more the speech that we hear with concerns in the toddler years. Turn pages in a book, cut, Tower of 7 blocks. So I don't necessarily have to go through that. And here we go. This is the speech. By the time they are 2, they should be able to understand complex commands. So I usually say, do they understand Can you go into your bedroom, get your shoes, and bring them to me? Can they understand that? If they can understand that, I'm not too concerned about a child who's not saying full sentences at 2 or even having the verbal skills of maybe somebody else. And I will caution you, comparing is not a good thing to do, but it's hard not to. Okay? I had twins. How can you not compare the two? When one is doing one thing and the other is not, you're like, oh my gosh, this one's not doing it. What's going on? I'm panicking. And then you always compare to the older siblings. And so it is hard not to compare, but each kid really develops on their own. And again, the pediatrician has key markers that each one kind of goes through. And you've probably been to the pediatrician's office and they ask you all these questionnaire things that you fill out. I know our office does it. Those are some things also that we use as a guide to say, hey, you know what, maybe we're not on track with it. So you need to bring up the concern, especially with the speech concerns, and let your doctor talk to you about, no, this is okay. No, this is not. We need to do further evaluations for it. And then the famous, so simple 2-word sentences for 2-year-olds. That's what the telltale, the big thing is. At 2, they should be putting 2 words together. But for me, I go. That's fine. Mommy, please. It doesn't have to be more elaborate from that. And even at 2, if they're not doing it, I say, well, does he understand you well? And if, again, with boys, I have a tendency to be more laxed. You know, let's, at 2.5, if at 2.5 we haven't made any progress from 2, then I'm concerned. If we're slowly making progress, my oldest, I'm going to brag a little bit. He's a pretty bright kid. He really didn't talk much till he was 3, but he understood really well. He understood things really well. And every month he was progressing along. He just, my 18-month-old daughter, oldest daughter, she was talking better to him at 18 months than he was at 3. But again, I used the gauge that he was understanding, picking up things really well. I'd say, at 2, he was able to, I'd say, where's the blue color? And he would point at it. And that's usually a thing for 4-year-olds. Okay? So that's why you can't just take one thing out and put that. You have to take things in the all context, okay? And you're all going to have those concerns that, is my kid developing okay? Those are when you write those questions down and you take them to your doctor, your provider at that point. And then the no. They do know no for some reason. And it's a tough thing because you have this idea that your kid is going to listen to you and do what they say, and then they say that word no for the first time, and you're like, no, what am I going to do? No, no, no. And I'll tell you, the more you say no to them, the more they'll say no to you. So, and I'll bring this up again, and it's going to sound a little odd, but I use the pick your nose philosophy, okay? If your child does something, wait a while. Pick your nose and wait a while before you say no. Decide, is this really something I need to say no to? Okay? Because is it something I can slide? Because the more no's you say, the more he's not going to pay credence to your no's. And that's kind of a discipline issue. So I try, and I'm not successful, I try with 6 kids to limit to 2 no's in a day. That's all. No, don't, stop it. That's it. I try to redirect them. I try to do some other method so that they're not saying no to me back, and so that they understand when Daddy says no, it really means no. If you use no all the time, and then they're just going to be confused, okay? So back to the speech problems. We kind of went over that. If there is concerns of the delayed speech, the first step we usually do is a hearing test. The school systems here, Millard, OPS, Bellevue, they're very good at helping us. If there's a concern, they'll go out, the school system, and evaluate for speech. But speech is really what residents are taught through. You know, if they're not saying this by this age, this is a concern for speech. As you become more of a practice physician and a parent, you realize there is really a wide range of what can be normal. But again, an issue. Stuttering, I don't think a lot of people realize their kids stutter. I didn't realize it until I really listened to my kid. But kids will stutter, and you think they're just trying to catch what they're saying, but they do. They'll stutter by saying, may, and you think they're trying to think of what they're saying, but they're actually just stuttering and saying the word over and over again. Very common. If it progresses past the 3rd year of life and they are stuttering in the middle of sentences, that's usually not normal. But I can tell you a couple of my kids have stuttered, and they still stutter occasionally, which is okay. but if it's a persistent thing. As far as studying, what we always tell people is don't rush your child, slow down your talking. They're stuttering because, especially in a bigger household, they're stuttering because they're trying to get their words in and they're nervous. So slow down your talking. And then don't ever correct them. Don't finish their sentences. Make it a peaceful environment. So if your child does stutter, don't panic. It is very, very, very common issue. Emotional milestones. They're very self-centered. Okay, so they're realizing they are an entity now. Okay, and so they necessarily aren't very flexible at times. Now, again, you have to understand there's a wide range of personalities between kids. There are your really laid-back ones, and then they're the kids that you change something up and it aggravates them. Okay, so you have to understand your parenting skills. I cannot parent each of my 6 kids the same way. I have one kid, Spencer. He is as colicky as could be when he was a baby, and he is he's very sensitive, great kid, love him to death. But if something's off track, he'll let you know. Whereas I have another kid, she could care less. Sophia could care less. She'll just go with the flow. So again, you have to understand your personality of your toddler, of your children. They start to imitate you. They're doing things you want to do. You got a new baby, they want to help with their dolly. They're talking on the phone with you. They're going to be wanting to work on the car with you. They want to do everything with you guys. That's very typical. That means they're developing very well. And again, the 2-word sentences, try to start using please and thank you. Even if they're not talking well, do the sign languages for them so that they are getting those manners of please and thank yous. I feel like that's something we bypass. We don't get them saying that enough to understand that. And they do start to know their gender. They know I boy or I girl. Okay? So that is just a couple things that go on. Oh, my favorite, actually least favorite topic. And I'll tell you, I probably fared below average as a parent in this category about feeding. All my kids are very picky, stubborn eaters. The thing that I buy and I take into, and you can kind of read the slide here, but kids are going to eat when they want to eat, and the more you force them to eat, the more of an issue it's going to become. If your child doesn't want to eat, or is throwing the food down, or is throwing a fit, and you still want them to eat a couple bites because they didn't eat anything, and you're worried about their nutrition, you're making mealtime very stressful, and that will continue to propagate. And I'm going to admit, I'm not going to lie, I did that with my firstborn, and I learned that that's not the way to do it. When I backed off, and the best thing I did, I bought a dust buster. And so if he wanted to eat messy, I didn't care, because after he was done, I just vacuumed up with that dust buster and we were good. I'm on my 5th dust buster now because I use it so much as they clean up. So you got to understand that. But along the same lines, so there should be some rules to dinner time. And what I do is you guys shouldn't be a short order cook. You shouldn't be, I got to get him to eat something, so let's try this. Oh, he doesn't like that, he doesn't want to eat that, let's try this, let's try that, let's try that. No, you give him 2 offerings, what you guys are offering and maybe one other thing. And you kind of stick to that. If he doesn't want to eat it, then the next time snack time comes around or the next meal time, then you put him down and you give him the next meal. You don't panic. You don't panic until your pediatrician says, your kid's losing weight, he's not growing well, we need to do something. If your pediatrician, your doctor says that to you about your kid, then, we need to look at it more. But I'd say that's less than 5% of the time, okay? Kids will eat when they're hungry. My kids, notoriously, they'd go 3 weeks, not eat hardly anything, then 2 days, they're eating me out of house and home. And then I think, okay, we're over this, and then back to the normal thing. And they would gain weight. And if you didn't notice by the picture I put up there, I have very small kids. My kids don't even make the growth chart, okay? And so that's why I was a little more panicked because my kids weren't growing. And actually the pediatrician one time said, let's take a look at your eating habits with one of your kids. But since I've really backed off and not fret about their weights, it got better. We make it more fun. We tell stories. I've gotten a tradition with my kids. We say, what was your favorite part of today? What was your worst part of the day? So they all have to share, and now they get really excited. So those are traditions to start when they're toddlers. Whether that, I mean, even the 2-year-olds say, "Mommy home." That was his favorite part of the day. Okay, so those are just some traditions. Make it fun, the eating time. Don't fret about it. They'll go through those food jags. No joke. For 5 days, my kid ate 1 bite of chicken nuggets. That's all he ate for 5 days. Okay, I think I propagated that because I kept forcing him, and it was a battle of wills. Okay, but you'll have a lot of questions about that. Feeding is, to me, probably was one of the toughest things with toddlers because they're feeding great, and at about 15, 18 months, you'll start to see that it's not so great anymore. And you're like, oh, and foods they used to love, they won't eat anymore. It's very typical. Okay? 2% milk or skim milk. I'm not a big proponent. Unless your kid's obese, if they want whole milk, they can do whole milk. Okay? Unless your child is obese or close to obese, I'm not necessarily a stickler for that. I want them to drink milk. So if it has to be whole milk that they'll drink, they won't drink 2% or skim milk, by all means do that. I'm even to the point, if your kid won't drink any milk, try even chocolate milk. Okay? Because they need that calcium as they are growing. But along the same lines is, you don't want them drinking so much that they're not hungry. And that's what a lot of kids will do. So we always, if my kid's not eating well, we always offer the drinks after the meals. And if they eat well, they can have as much as they want to drink. If they don't eat as well, they don't get as much. Okay, but I don't want them, because kids will fill up on drinking. You'll see these toddlers, the parents will say, he drinks a ton. Well, how's he eating? Oh, he won't eat anything. Well, because he's filling his stomach up with drinking. Okay. Oh, look, don't stress if growing well. I didn't even know that said that. Okay. And then those are kind of some of the things we talked about. Okay, Dustbuster. It's not up there, but very good investment. Or a maid, if you're rich enough to afford a maid. Then just kidding. Okay, and then kind of once they're ready to leave, let them leave. Don't force them there. And I will tell you, one of the strategies we use, and it's probably not good, is we will say, if you eat 3 more bites, then you can have a treat. Okay? Because for me, I'm motivating with that. It's probably not necessarily the best thing. If they've eaten well and they deserve a treat, that's great. If they're not, then you should then give them sweets and get them a sweets. I'm doing. Okay. Is Jack here too? Okay. Okay. So eating, I think we've hit that as much as we can for tonight. Oral hygiene. This is very important too, but I'm not going to spend a lot of time. The key is brush your child's teeth, and if you have to, hold them down and do it. And what I did, my firstborn toughest, I'm telling you. I'd sit on a couch, I'd sit him on the floor, I'd put one leg over one shoulder, one leg over the other shoulder, crank the head back, and force the brush. Because I was just like, I can't, we have to get it done, okay? And we got a good brush. The best time to brush, I'd like to see it twice a day. Honestly, we do it before bedtime is the most important, okay? And then the #1 cause of cavities is sweet stuff. Those gummy bears, those poo chew things or whatever, fruit snacks, those are the worst things you can give because they stick on the teeth. I'd rather you give your kid chocolate than those gummy bears because they just stay there. They're stuck to the teeth. Okay? So you can kind of read a lot of things with that. Now the recommendations is with the toothpaste, this is new, is that you're supposed to use toothpaste at any age and leave it on there. They don't have to spit it off. The fluoride stain on the teeth is healthy. So I do that now personally. After I brush my teeth, I'll spit out a little bit, but I won't rinse or anything because the fluoride is supposed to be healthy for your teeth in the toothpaste. Cavities are very prominent, and I didn't mention the second most common cause of cavities. Anybody have an idea what the second most common reason children have cavities? Sweet drinks along with the sweet foods. Yep, it's the adults kissing them on the mouth. Okay, your flora, your bacteria in your mouth, and that's protected by the enamel on your teeth, is not good for a child's. So if you're a parent, especially who has had cavities as a kid, you're passing that bacteria that caused the cavities onto your children. So I tell my parents, no kissing on the mouth. No adult should be kissing a kid. Don't take their binky and clean it with your mouth and put it in there. And people do that, okay? That's not what you want to do, because that's the second most. Now, mind you, the sweets and the sugars and the gummy bears way up here and the kissing on the mouth way down here. I mean, it's a big, huge gap, but it is the number 2 cause. Does that make sense? Okay. And then kind of what we talked about. Visiting the dentist. I'm going to tell you what the guidelines are. The American Academy of Pediatric Dentists recommends a first visit at a year of age, or 6 months after the eruption of the first teeth, or 1 year of age. The American Family Dentistry recommends the first dental visit at 3 years of age. So there's a little difference. My thing has always been is I teach oral hygiene, because really that first dental visit is about oral hygiene. They're telling you, don't kiss them on the mouth. This is, you got to brush the teeth, avoid the sweet foods. They're not necessarily going to find a cavity at a year of age. So, and get off the bottle. If at a year of age you're doing all those things, then I tell them, and you brush them teeth, well, I say, let's go at 2. Okay? But if you're not doing all those things, I say, you need to go at 1. So that's kind of how I do it. I think waiting until 3 is too long, because a lot of kids have already had cavities by the time they're 3. Okay. Thumb sucking. I don't know how many people deal with this. I really think to avoid thumb sucking, we got to start before the toddler years. When my kids, at the first sign of my kids sticking their hands in the mouth, I'm instantly holding a binky in their mouth. So when they're 3 months old, 4 months old, and they're sticking their hands and their fingers in their mouth, I don't allow it. I hold a binky in them. Even if they won't take it, I'll hold a binky. And every time they put their hands in their mouth or their finger in their mouth, I put the binky in. And eventually they'll take the binky. And that's how I avoid any of my kids of being a thumb sucker. That's what I did. But let's say you didn't get to that point. Now they're 2 and 3 and thumb sucking. That's a tough thing. And it doesn't become a problem until they have dental problems, until the dentist says, hey, your kid's teeth are malaligned because they're sucking their thumbs so much. I still have 18-year-old moms that come into my clinic still sucking their thumbs. It's amazing. I had to, the one girl, I saw her today, she, with her baby, I had to keep pulling. I was like, what are you doing? Take your thumb out of your mouth. You're 18. So what I've found with two-year-olds, what I do is I try to get them to divert the thumb sucking, the soothing, to something else. So if when they have their hands in their mouth, if you can get something else in their hand, and the same thing every time, like stuffed animals, blankets. Some people say, well, if they have the stuffed animal blanket, they'll just be doing this with the stuffed animal and the blanket. But they at least are having something else to soothe them. If at night, like for the binky at night, to get rid of the binky at night, I'll tell them, have the binky, don't put a strap in it. When it falls out, tie a blanket to the end of it or something to the end of it so the kid feels for that blanket, knows the binky's there, and will put the binky in the mouth. Eventually, after doing that for 3, 4, 5 months, he'll just reach for the blanket. He won't put the binky in the mouth, or she won't. It doesn't always work, but it's called diversion. Those are diversion or aversion training. And when they're older, what we tell you to do is stick a mirror to them so they see them doing it, because they don't even realize they're doing it. So like nail biting, that's what I tell people how to stop nail biting, is keep a pocket mirror by them, and every time they put their nail in their mouth, say, look what you look like, with your older kids too. It's so they're aware, because people don't even where they're doing it, is the thing. So if they see themselves doing it, they know what they look like doing it. Okay, and then dental appliances, when it gets bad, they have to wire kids' mouths shut sometimes because of that. Luckily, none of my patients have had that done. Illnesses. So if your child is in daycare, they're going to have more illnesses than if your child's not in daycare. Okay? I love daycares. They keep me in business. I don't think I would have a job if it wasn't for daycares. Okay? Plus, daycares provide a social medium for people, as well as a cultural medium for infection. But I also think it's great to be able to stay at home with your kids. I think that's an amazing thing. If your child's in daycare, they're going to get sick, like I said. And I tell people that first mobile year, that first year they're moving around, expect them to be sick from November to March. Okay? 8 illnesses. They're going to have a cough for more than 3/4 of that time. It's bound to happen, okay? You'll go to your doctor, they'll say, okay, let's try this for the cough, let's try this for the cough, but inevitably they will be sick for a majority of that time in daycare. A note, though, is they did a study at the end of kindergarten. They compared children who were in daycare and preschool and those children who were stay-at-homes, who never went to school and anything. And they, at the end of kindergarten, they compared how many illnesses they got. And the kids who were in preschool and daycare all those years and the kids who weren't, never in kindergarten, had the exact same, not the exact same, but about the same amount of illnesses at the end of kindergarten year. The difference is the kids that stayed at home got it all through kindergarten, okay? Unless they were homeschooled, obviously. So they do eventually get that. The daycares are building it up, building up their immunity, and in the people that are staying at home, they usually get it during kindergarten time, okay? So, fever. I know people are very paranoid about fever, but we have a saying that once the kids turn 3, a fever in a kid is the top 3 causes for a fever in a kid: virus, virus, virus. Okay? So 2, the top 3 probably the top 2.5 are fever, fever. Okay? Fever is not a bad thing. And in fact, in my family, but I'm a pediatrician, so it's not as fair because I can almost look in their ears and stuff. But I usually don't treat a fever. I don't give them Tylenol and Motrin. I usually let them have the fever. I feel like that's your body's way of fighting the infection. Now, if my kids are crying because their head hurts so bad, or they're puking because throwing up because the fever's so bad, they're just very uncomfortable, I'll treat it. But if they have the fever and lying down and just I'm cuddling with them and stuff, we don't treat the fever. And personally, I can't prove this, but personally, I feel like my kids get over illnesses a lot quicker than the kids I see in clinic where the parents are giving them Tylenol all the time. But I swear, my kids hardly ever get the Tylenol and Motrin for fever. So don't be fever paranoid. I usually say I personally, but your doctors might be different, I personally use a 5-day rule. If your child has had fever persistent for more than 5 days in a row of 102 or more, we need to see them. At that point, there's a slightly higher risk that it could be something more than just a virus. Okay? But if your kid's vomiting, has a really bad sore throat, there's other issues. But if he's febrile, if he has a fever but still drinking well, and is not struggling to breathe, he can wait that out, or she can wait that out. Ear infections, you know, a 2-year-old, I don't really worry too much about ear infections because most kids can tell you owie by that time. It's the babies that worry about the ear infections. And in reality, the new guidelines say, they say 18 months, I use 2 years. If a child has an ear infection and is not a kid who gets ear infections all the time, if your child has an ear infection, and I practice this with my kids, you give Tylenol and Motrin for 48 hours for the pain, and if the pain's gone, you don't have to treat the ear infection. In fact, I can tell you my kids, they don't get ear infections a lot, but we've probably had, with the 6 kids, probably 6 ear infections, and we've treated 2 of them. Okay, because they were younger than 2. So we do Tylenol, Motrin for 48 hours. So you don't always have to treat an ear infection. Over age 18 months is what the guidelines. I use 2. If they're less than 2, I usually do treat them because they can't usually tell you as well. Urinary issues. This is a big thing. No bubble baths. And I'll tell you what. I struggle with this one, not the bubble bath issue, but the urinary issues. And not the urinary issues, it's actually the vaginal issues. It's up here under urinary, but really the bubble bath issue is not for urinary tract infections. Urinary tract infections are not caused by bubble baths. That's a misconception that's even bred into the medical community. There are doctors that will tell you, oh, she got the urinary tract infection, it's probably because of bubble baths. Had nothing to do with the bubble baths. The bubble bath does not introduce a bacteria into the urine, okay? What it does cause is vaginal irritation, a vaginitis. And I'll tell you what, my daughters got this all the time. They would say, owie, owie, and their area would be red. It would burn to pee, but it was because the urine was leaking on the vagina and the vagina area was irritated. And that comes from lack of hygiene. They're not wiping correctly. They're not wiping the urine correctly. They're sitting in bubble bath type of things. I struggled with this. Both my girls did this, and we did everything properly, and they still had issues with that. Never had a urinary tract infection, but did get a lot of vaginitis. And contrary to what most people think, including pediatricians, young girls, 2-year-olds, 3-year-olds, before puberty and out of diapers, they do not get yeast infections. Their vaginas are not estrogenized to get yeast infections. So everybody thinks it's a vaginitis from yeast and will give you yeast cream. Rarely does it happen. And again, the residents I train, when they come through the clinic, they've seen other doctors and they'll think it's a yeast. I'm like, no, look in the books. You have to have the right pH for the yeast to grow. And you don't get to that right pH, the right acid level, until you reach puberty. Okay? So some of the daughters may have been treated for yeast infections before, for a vagina, not diaper rash. Diaper rash is different. We're talking within the vagina itself. It's mostly a hygiene issue, and by cleaning the hygiene area. What I do with my girls is we take a cup full of white vinegar, put it in bath water, fill the bath, and just let them sit in there. That usually helps with the hygiene. Febrile seizures. Anyone have a child that had a febrile seizure? Okay. Very, very common, believe it or not. I actually spoke on the news about febrile seizures about 4 years ago on one of the news stations about it. These are hard because in most cases, the child has a seizure before you even realize they have the fever. Okay? And no matter what you do, Tylenol and Motrin, it's not going to stop the seizure. They're going to have it regardless of what you do. And it's about, I want to say 1 out of 100 kids get it, and they have a slightly increased risk of having epilepsy, but it goes from 0.5% for the regular population to 1% if you have a febrile seizure. So it's not like a lot. We can go into details about that, but it's relatively uncommon, but I see it fairly, I won't say common, but it definitely does exist, as we have one parent here that does have a child with that. Heart murmurs, nurse pain, elbows, intoning, eczema, those are some things. Heart murmurs, about 1 in 3 kids will have a murmur, and it's innocent. I mean, I can actually probably pick up 50% of the kids with heart murmurs listening to them. It is almost all, 99% of the time, it's going to be an innocent heart murmur. So if the classic is the kids at the dental school or the kids at the dentist for pre-op, and they listen and they're like, oh my God, they hear a murmur. Well, I've never had a kid picked up from a dental office that I've seen whose heart murmur was anything but the innocent heart murmurs that we hear kids. They're thinner, it's very common, they outgrow it. But you hear heart murmur, everyone panics. But heart murmur in kids, majority of the time, does not mean anything. And if your pediatrician or the child's doctor is astute enough, they can listen enough to tell what is not innocent and what is innocent. Nursemaid's elbow, you ever heard that? The pulling up, so your child falls, you're holding your child by the hand, and you're walking, and they misstep, and they're falling, you pull them up by the arm. Don't ever pull your kid up. When you're walking with them, hold them with the arm up here. Hold them from here. Don't hold their hand above them. Okay? Because you pull it, you get what's called a nursemaid elbow injury. The head of the down here will pop out of the elbow joint. And you won't think anything's wrong other than the kid will just hold the arm like this. Okay? It's easily treated, but the more times it happens, it makes it kind of lax and it's easier to happen again. Okay? I had a niece it happened to. We were able to reduce it pretty easy. Fairly common. So when you walk with your toddlers, hold them from here if you're going to hold them. Don't hold them from the wrist or the arms above them. It's okay to hold it down here, but don't hold it like this. Eczema, that's a lot of that. The key to eczema is just moisturizing, just to keep them very moisturized. And kids at 2 years of age in the winter times, a lot of times they get eczema. You want to use something with no perfume. Everyone likes to use baby lotion. Baby lotion smells good. It's good to massage. It's not good for dry skin. And eczema is just more severe dry skin. That's what that is. So moisturizing with Vaseline. My kids got eczema. My kids definitely got them. It's hard to keep up on it. But moisturizing, more moisturizing. Bedtime. Oh, this is probably my favorite topic. I truly believe that you can be a better parent if you get to sleep. If you sleep good, then you can be a better parent. And so I train my parents from the get-go. When they come for that 2-week check, I'm like, here's your booklet on how to make them a good sleeper. Here it is. This is how you do it. You start now. Because when they're 2 years old and you're coming with me with sleep problems, I don't want to say too late, but we're in a world of trouble. Okay? So I'm going to give you some keys. And all 6 of my children slept through the night by 2 months. Okay? Some of them 14 hours in a row. Okay, so I felt like I was a good parent that way, at least from that standpoint. So, for the toddler, The mistake, though, that we made with our toddler is we got him out of the crib too quick. We're like, we want him to get older. We want to put him in that toddler bed or that big boy bed. And he wasn't ready. He wasn't climbing out of the crib yet. We didn't need to get him out. So we thought, oh, we'll get him out of the toddler bed. That threw us off a little bit. Okay? So you want to keep it the same ritual. You want to keep consistency going. And it may change here and there. Like, he was always wanting to read this book, but now he wants to read this book. That's okay. But you have to be firm. And I think I have another slide about this. Maybe, yeah, here. This is the other side. You have to be consistent too. And people fail because they went over to grandma's and they didn't keep the ritual, the consistency going. They took a vacation, or the kid got ill and they changed their routine. And I understand changing a little bit. One night's okay. The second night you do it, it becomes a habit, and you've gotten all that good work, you've got them into good sleep hygiene, you've had to backtrack now and redo it again, okay? You want your child to fall asleep without you in the room. Don't be the type where you let your toddler fall asleep with you in the room, because when they wake up and don't see you, they're going to wake up again and you're going to have to go back in the room. Don't ever let your child in the bed with you in the middle of the night. Now, Sunday mornings, do we let our kids climb all into bed with us as we're hanging out Sunday mornings before church? Sure, we do. But we don't ever, even when they're babies, we don't put them in our bed with us. If they're sick, they still have to stay in their bed. We're not mean. We'll go in there and soothe them and stuff when they're sick, but we don't put them in the bed. Again, one time probably okay. The problem is that second time you do it, it becomes a habit. So I am very big on that. Let's see what else they had. Nightmares, night terrors. My kids have that. It's kind of, especially the night terrors, that's a prelude to sleepwalking, sleep talking. It's all part of the same genre. And so my oldest kid now sleepwalks. I have my oldest daughter sleep talks. Spencer, one of my twins, has night terrors. And each of my other kids have had occasional night terrors. So I think it's an inherited thing, because I'm assuming, since I have that many kids that have those issues. The difference between nightmares and night terrors, they're not really awake. They're not totally awake. And they usually happen about an hour and a half after they fall asleep. Nightmares, they're completely awake. They're crying, they're wanting to hold on to you, and they can kind of tell you what they're scared of. Nightmares, the only time I worry about nightmares is if it drastically increases. So he was having a couple times a week, now he's having it every night. Something's going on. You need to investigate, explore what has changed that now all of a sudden he's having nightmares every night. Okay, so that would be a telltale sign for me. And then the big bed we talked about. Anxiety and shyness. I think a little bit of preschool here and there. I have a niece that's kind of like that. A little bit of preschool here and there, a little bit of daycare, mommy's day out. So we used to do my gym when our kids were toddlers, when we kept them more at home. When we actually did have a nanny, that we could do that. But we wanted them to get that exposure. So get them involved with some other program, whether it's once a week, twice a week, where you're going out with other parents. Plus it's cool with the parents. You get to talk to the other parents and complain or praise or brag, either way. So, crying. The toddlers are going to cry. They're going to throw fits. And I know they have a separate talk on the discipline. I know you guys all wanted to hear about the discipline, and we kind of touched base on that. And as you leave out, there's a book in the package, and you probably have gotten it if you have a children's physician's doctor. You probably got it in the office. That book you can read in 30 minutes. It is superb. A lot of what I say is from that book. It is a really good book. And once again, it's easier for me to say it, it's easier for me to read it than apply it. Okay? But if you can step back and let emotion don't build up the emotion, the frustration, you can be a much better parent. But that is really hard. Okay? It is tough. And again, if you have frustration, you may want to keep a distance. Allow yourself to calm. That's the big thing. Okay. Sleeping we kind of talked about. If all else fails and your kid still is not sleeping, if you talk to the Nebraska Sleep Study for Children, the people that out at Monroe Meyer, they have the solution. And I'm able to do the solution with my kids, but I have yet to find another parent that can do it. But there it is. Cry it out. Honestly, if you let them cry it out, it may take a while and you'll be frustrated as heck. But what I did with when my son was doing that transition between the crib and the toddler bed, and we made the mistake of taking it out, and then when we went back to the toddler bed, the crib, he wasn't sleeping, we let him cry it out. I gave my wife earplugs, I put a sound machine by her bed, and I closed the door and put the monitor way in the back. So basically she couldn't hear it, and I knew when the crying was bad enough that I had to go in. Okay? So what I tell parents is if you can't do this, which by the way most moms can't, you have to every night say, okay, for 15 minutes I'm going to let them cry it out. And then the next week 20 minutes, and then 25, and slowly go up. And eventually that does work. But to slowly let him cry it out. But at 2, depending on how long haven't been a problem sleeper, it may take 3 months of doing that. It's not something that works just like that. Okay. Negativism. And a lot of this was the behavior stuff we talked about. Pick your battles, the pick your nose philosophy. Try not to say no, stop, don't much, too much, divert them. Let's talk, I want to talk briefly about spanking because I may have a different view on spanking. I don't believe spanking is child abuse. Do I believe you should spank your children? No. And the reason is 2 reasons. One is because it teaches them that, okay, mommy and daddy wanted me to do something, so they spanked me to get me to do that. So when I'm in school, this kid's not doing what I want to do, so I'm going to do and spank them. So kids do what they do what you do, not what you say. Okay? You can say, don't hit anybody, but if you spank them, they see that. Okay? I don't believe it's abuse, but they see, hey, to get this kid to do what I want, I need to. Of all the kids who have been kicked out of kindergarten, believe it, I've had kids suspended from kindergarten. I asked the parents, so what'd you do about it? Oh, he got a whooping when he got home. I'm like, well, that's why your kid's getting kicked out of kindergarten for hitting, because that's what they're modeling. And then people hit when they're angry. If you can truly back off, wait an hour, calm your nerves, and then say, okay, it's time for your spanking. The problem is a 2-year-old won't relate it. Your 10-year-old might, but your 2-year-old won't. Okay? We hit out of anger sometimes, and that's not what we do. You should be, if you're going to spank, you should be spanking out of love, knowing that you're teaching. But remember, you could be giving the wrong message. Have I ever spanked my kids? Twice. 2 times. 2 of my kids have gotten spanked twice. And they got spanked, they got slapped on the wrist because they ran across the street. And I needed to let them know at that age, and everyone was like shocked. And you know what? Those kids have never crossed the street again without me. Because Daddy doesn't hit. Daddy never spanks, so something must have been really wrong. And I didn't do it out of love. It was more out of fear that I spanked them because they did that. Okay? Does that make sense? Okay, then again, my philosophy, some people can spank their children and the children do fine. And the Bible says what? You spare the rod, spoil the child. I don't believe. That's not my philosophy as a parent. That's not what I teach as a pediatrician. And that's what I don't teach the residents that either. Temper tantrums, boy, I'm not so good at this. I will lose my temper, and I will yell back at times when they don't listen to me. But really, you need to keep calm during these times. Kids are going to have temper tantrums. They're going to melt. When they're tired, they're going to melt down, okay? So don't try to avoid when they're tired. Try to avoid getting them too riled up or saying no to them at those times. You got to know your kid that way. And you ignore them. And what I do, though, is the mistake some parents make is the kid's over there and the kid's throwing a fit and they just walk away. The kid doesn't know that you hurt him. Okay? So he's going to scream louder. What I do is I pick up the kid and I move him to a spot, the timeout spot. Or if he's laying on the ground right next to me, I safely walk over him, look at him, and then just keep walking. Okay? So he knows I saw them, or she knows I saw them. The other thing is, praise them when they're being good. It's going to say that. Praise them when they're being good. And this is really hard for me, but you're supposed to, when they're being good, play with them, give them a ton of attention. But you know what? When I'm home, I got to do the laundry, I got to mow the lawn, I got to clean the house, I got to do all this other stuff. And when they're good, I'm trying to get all this done. But in reality, that's the wrong time to do it. I should be doing all this stuff when they're throwing their temper tantrum, so that I'm getting all that done. So I'm ignoring that and getting all my stuff done. I love to do laundry when they're throwing a fit. Okay? If they're being good, what I'll say, hey, come do laundry with me. And even though they make the task longer, it's a fun thing to do. And they love it. The toddlers love doing laundry. Oh, let me pull it out. Yeah, they're making a mess, but that's okay. It's that extra thing. They love cooking with mom. I'm not a good cook. I do my grilling, but that's about it. So, okay. Breath holding spells, I'll briefly touch on this. Very common, actually. it's going to look like the kid has a seizure or pass out. Some kids will cry so bad that they'll hold their breath and they'll just pass out. No kid has ever died or hurt themselves from doing this. But it is very common, and parents do freak out. If you ever want to see cool videos, go to YouTube and put breath holding spells. You'll see kids having them. Oh, they're cool. They're really cool, but I don't want to have any of my kids have that problem. Biting and hitting, here's some things they talk about. Don't bite your child back. If your child bites or hit, it's a stern no and move them from the situation. I had a biter. My oldest was a biter in the daycare. The daycare called me. He was biting a girl he liked, to be honest with you. So we addressed that. I thought they were going to kick us out, but it was fine. And then my youngest child was getting bit constantly by the same kid. I mean, gashes in the face, to the point where I'm like, what's going on? My kid's being beaten up. We can't send my kid to the daycare. So it does happen quite frequently. And by the way, daycares should have policies for biting, and they should. With our kids, there were protocols set up to prevent the biting to go on. But at home, mistakes I made with my oldest is I used to on his tummy all the time. So for him, he doesn't. You're putting in the mouth on the child. It's a plaything. Some kids will bite thinking they're doing the same thing you do. So watch what you're modeling. Okay. Same things with, and don't bite back. People say, well, then they'll know the pain it causes and they'll stop doing it. It doesn't work. It does not work. That's not what you want to do. And then prevention, try to prevent the situations where you know he's going to bite. Like I'll know when my kid's playing with me a certain time, I know when he starts to lean, oh, he's coming to bite me, so I'm going to try to avoid that. It's painful. So discipline, we've kind of went over all this. The toddler timeouts, you probably heard about that. You put them in for the amount of age. Sometimes I have to hold my kids in timeout because they won't go in. So I have no problems holding them in timeout. Some kids are really good with timeout. Some kids are not. Some kids it works really well. Some kids it doesn't. That book that you're going to get goes over and tells you if your timeout's not working, what to do. But that book has a great philosophy for timeout. I'm trying to get through quicker so we can ask some questions. Again, the discipline, there is another Parenting U class just on discipline. And again, that book is very good. Bossiness and negotiations. At this age is not the time to give them choices. It's not to be, well, you can either do this or this. No, they're not ready for that yet. Okay? You can talk them through things, but don't give them the choices. For the 6, 7-year-olds, I love giving choices. Instead of telling them what to do, I said, okay, you have 3 choices. You can pick one of these 3. And I always make the choice I want the best one and the other 2 really terrible choices. But at least they feel like they're making the choice instead of me telling them. And the last one I just had to use today on a parent. Don't make threats you can't follow through with. Don't say, I'm going to take away all your toys in the room and throw them away right now. Well, you're really not going to do that. Okay, so don't over-exaggerate. And with my 9-year-old, my 8-year-old, I feel like I do that all the time. But kind of watch the ramifications. Don't overdo yourself out of anger. Say things that you really can't follow through with. Potty training. Oh, I forgot about that. This is an issue. I have a little different philosophy on potty training. People say that you can do it too early. I say you can never introduce it too early. It doesn't mean you have to actively do it, but putting a toilet chair out there so that they can play with it a little bit, having them watch you go to the potty, I don't think anything's that wrong. And if they give you any indication that they're ready, what we did with our kids, believe it or not, is we would have a routine where they would get their sippy cup of milk, we'd put on their favorite TV show, we'd put the potty chair in there, and they'd sit on the potty and watch the TV. And then afterwards, we took the diaper off and had them on there. And the first time they accidentally peed in there, we made a huge deal out of it. And we were so excited, and then they started to understand that. And that's kind of how we started. But you're going to read different things on it. The thing is, never make it a negative. Never make it a negative. And let me tell you, the fact that one of my 6-year-olds still wets the bed at night, I want to wring his neck. But I can't. I have to keep it a positive. And the thing I find is, when they're ready to be a big boy or big girl, that's when they're really ready to do it. Okay? And you can use that. But there's so many different philosophies on it. The key is don't make it a negative. 15% of kids still wet the bed at 5 years of age. 1% of 15-year-olds still wet the bed at night. So it's pretty, and it's a family history. So if either parent had problems wetting, and I don't think I did, but I never asked my mom. If either parent wet the bed at a later age, your child will also wet the bed, most likely. One of them will, not all of them. Play education. What I wanted to say about this is unstructured play is the most important thing in toddlers. You don't have to structure their play. You don't have to have, hey, let's play this game. We're reading a book. You don't have to read through the book, okay? TV time, everybody knocks TV time, and TV time is not a good thing necessarily. But if you're watching Dora with them and you're doing it like a book, and you say, okay, what color is that? Or, oh, what's Boots going to do now? Or what's that? You're actively involving them in the TV. It's not one of these. It's not that bad. So when they say 2 hours of screen time, I say 2 hours of interactive screen time, not 2 hours of babysitter time, okay? So that's, I think TV time can be good if you use it the right way, or computer time is good. It's, if you just let them do it by themselves and you're not interacting with them, and it's not good. It's not good, effective time for them. And then we do scavenger hunts. We do neat things. We do Play-Doh. We bought some sand. We bought moon sand. The kids love that. It's so creative that we just let, and we have, that's that dust buster again. We can just dust bust up the sand. I'm telling you, it's got many uses. Special time, I think your child should get special time. Your toddler should have special time with each parent. So we call it, it was 6 kids, it's hard to get each one of them, but like when I'm going to go do a chore, I have to go to the store, and my wife is at home too, I'll take one of them with me, and that's our special time. So I'm getting chores done and stuff done, and so my kids died to go grocery shopping with my wife. Can you imagine that? They die to go with her. Even the boys, the 6-year-old boys are wanting to go grocery shopping with her because it's that alone time. Kids remember that most. And then go out. My wife and I have a paid babysitter. Yes, we pay $16 an hour, so if anybody wants to go and do that. But $16 an hour for our babysitters. We have 2 Saturdays a month that we automatically have a babysitter and we go out. It is scheduled in there. And if you don't have that, men in this room, you need to get that. Because if you're not spoiling the mom, then things aren't going to be doing as the moms needs to be taken care of too. And they need to be treated as women too. If you're a single parent, you need to find babysitters and you need to go out with the girls or the friends and you need to get out because you need to be an adult. You need to feel like a woman. You need to do that. And I can't, on my marriage with my wife went so much better. The last 3 years since we've scheduled this and changed some things. I've been married 15 years. I'm telling you, the last 3 years have been spectacular because we do this routinely and we recharge ourselves. Pearls. And this is kind of a lot of the stuff we saw. Consistency, consistency, consistency. Enjoy. Even though I think God made toddlers so cute. I actually like to see my kids scream sometimes and throw fits. They're so cute when they throw the fits. When they're going like this and they're screaming. I actually, other than the screaming part, looking at them, it's kind of cute sometimes. They're really cute and adorable. And then the third one's important. They sometimes feel, you got to kind of make them feel like they're in control. You're really in control, but sometimes they need to feel like they are. So don't be saying no all the time to them like we talked about. Okay. And then those are kind of some of the summary stuff. And then these are my kids again. I like to end with them. I love being a pediatrician. I love what I do. I do what I love. But if I could just hang out with my kids and my family all the time, I have to be honest with you, I would, because I just love doing that. And I hope that's how you feel about your toddlers and your families, because for me, I'm too old now to have any more kids. I'm done. But it's hectic, but having those 2-year-olds are tough, but it's so worth it, guys. And then this, oh, I'm sorry. These are some of the references for this. And we have a little bit of time. I don't know how far we can go over. If anybody has any questions they want to talk about this, or I can give individual, but I will tell you, you need to talk to your doctor also about this. Yes? You're going to get it on the way out. It's a thin little book, and it's part of it, and it's a 30-minute read, and they're going to give it to you as part of the package. Okay? No, not a problem. Good question. Yes.
We have a 2.5-year-old and we have a baby.
Okay.
And we're about ready to cry it out for the baby. So how would you suggest I broach it with our 2-year-old? Should I tell him, hey, you're gonna hear your sister crying, or do I need to go in if he gets scared and starts crying?
So are they in the same room? No. Okay. They're right next to each other. You know, we put a sound machine in our kids' rooms so that they wouldn't hear that. Okay, and we didn't necessarily have to broach it, but you can tell them, you know, baby's going to be crying, we want him to sleep good. I just don't know, I'd have to see your child to know his maturity level of how much he would understand of it. My 2.5-year-old daughter would have totally understood it. My 2.5-year-old sons would not have understood that concept. If he broaches it with you, you can talk to him, or I'd have to know your kid more. And, you know, if he was a patient, I'd be able to probably advise it a little bit more. So I don't know if that's helpful at all, and I apologize. Okay. Yes?
Do you have any suggestions on how to handle the whining?
The whining. Well, it depends on what kind of whining. Like, I have a suggestion for the whining question type of things. So if my kid's like, why do we have to do this? Why? Oh, you know, those type of this. I give them a 3 or 4 minute made-up dissertation. And if they try to interrupt me, I'm like, no, 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 I'm not finished. And I keep going and going, and then all of a sudden, they don't want to ask any more questions because they're bored with the answer. That's how I approach it, okay? I do. I'll ramble on like I rambled on today. And that's kind of how I address the whining, okay? And again, at different ages, it does that. I don't know if that's helpful at all, but that's kind of what I've used. So, yes?
What do you recommend for hitting? Like, my daughter, she's 2, she hits, like, her dad and her older brother, and she hasn't, I mean, she's kind of, like, threatened this one, but she hasn't actually hit the baby yet. But it seems like the males in the family she hits, like even in the face, or she'll push my 13-year-old's head, and I put her in timeout, but other than that, that's a real tough situation, and I get that question a lot. And again, the best thing to do is to try to figure out when she's in that, what's triggering that. Avoiding the situation before it occurs. So if it's when she's wrestling with dad, or when it's after nap time, or if it's before a meal, seeing if there's a pattern to it to try to avoid the situations. And then you're doing the right things. Immediately you say no, remove her from the situation, and say, you know, don't hit, we don't hit, and then just do that. Consistency. It takes sometimes 10 to 15 repetition over and over again before they even start to concept it. It's like food. They have to see a food 6 to 7 times before they'll even try it sometimes. So there's not an easy answer. I've had hitters, and we've tried to avoid as much the situation. Okay, but it's not an easy thing to deal with. It's like the biting. Yes.
Topic. We have a 20-month-old son, and he doesn't necessarily hit people, but when we tell him to do something that he doesn't want to do, or we tell him an answer he doesn't like, he'll go hit the couch, or he'll go hit something. Should we tell him to not do that, or is that okay because he's frustrated? Or
he's getting his frustrations out, and a lot of times what I like to do, and I should have said this to you, is we'll say use your words. And a lot of times they can't. If they can't talk, that's a harder thing. But we'll say use your words as they get a little bit older and you can talk a little bit more. As far as that, if it's that's a tough thing because he's hitting the couch. He's trying to get the frustration. He's not going for people. He's not doing that. He's not like tearing up everything, is he? With it, he would. Yeah. As long as he's not hurting anything and he's throwing a temper tantrum like that, let him have it. But just ignore that. Okay? But if he's hitting somebody else, then you should address it. Yes? Okay.
Just real quick, on the Milestones, what is cut?
Scissors.
Okay.
They're starting to cut, but they won't be able to hold the scissors very well.
Okay.
Yeah.
And then we have a crib that we converted to the toddler part. He's 23 months. We did this probably 3 months ago, I would say. He was fine for a couple weeks. We had her niece come, and he would get out of bed and stand at the stairs, and all that. So, excuse me. We ended up turning it back around. My question is, do they have to literally jump out of the crib before you put them into the toddler state? Or
that's how and you don't ever need a toddler bed. You don't need a toddler bed. People use a toddler bed. I actually find that if I move them to a queen-size bed or full bed or a twin bed, they're less likely to get, and I put the rails up, they're less likely to get out of that than the toddler beds. I think I used my toddler bed for my oldest, and I realized I'm not doing that anymore, and we reverted back. But you can move them out at any time. My suggestion is when they're climbing out, you should take them out.
Okay. And then I guess what do you suggest with the whole getting out of the bed?
Yeah. We're dealing with that with our toddler now because we made a deal with him that if he got potty trained, he would get a big boy bed with the twins in his own room, and then he figured out now he was climbing out of the crib, but he was not climbing all the time out in the big boy bed. We put up a little brace thing, and we take him back to bed every time with this, and if he stayed through the night there, we rewarded him with something. That's kind of how we did it. But it is a hard thing. My wife and I talk about how it was so easy when he was just in the crib. We could let him in there and he'd cry himself to sleep. But now in the bigger beds, they get out, or once they can climb out of the bed. We hate when they can climb out of the crib, to be honest with you, because luckily our kids are a little slower when it comes to gross motor, and so it's more closer to 2.5 and 3 before. I mean, there are some kids 15 months climbing out, 12 months climbing out. I'm like, oh, that would be, for me, that'd be tough. Yes?
Well, we're going to be having a vacation here pretty soon.
Good for you.
And family vacation, and both of our boys sleep in separate rooms, and so they're not used to being in another room with other people sleeping. So, and then Max is he's in a crib, so that brings a whole nother set of, staying in a hotel room and staying in a queen-size bed with your brother. It's completely different than the setup he has now, so.
What do I suggest? Well, first I would ask the hotel for a crib, because we always got the crib for the hotel. And then what we did is we positioned the crib as best, and we try to put a cover or something so that he could not see us. Okay, so we actually try to build a shield so they actually don't see us on it. If it means some of the doors of the bathroom open this way, so you put the crib behind that so they don't see them. So that's what we try to do. The key is once you get back home, know you're going to pay for it. And you're going to have to go through a week or 2 weeks of trying to get back to the norm. It is. We've done it. When we go on a vacation, and I have no other option but to have the kids sleep in the same room as us, when we get home, we're having to make up for it a little bit.
Okay, so don't try and we were thinking about transitioning them to sleeping in the same room together before we go on.
If that's something you want to do long term, sure. But if you're not and you don't need to do it, I would say no.
Okay.
Great question. You guys have a lot of great questions.
What's your recommendation on preschool? Do you say at age 3 or age 4?
I think preschool is more for socialization with you. So if you're doing a lot of other things, socializing with other kids, I'm not necessarily saying you have to do preschool. Some of my kids did preschool, some of them didn't. They socialized with other means. My kids who did preschool, I don't think were any better off, because the studies just show you that the amount, and this is going to sound really odd because it's going to be contrary to what everything you have heard, is that at 3rd grade, all the stuff that you did from birth to 3rd grade, at that point, evens out based on your intelligence levels. Okay? So if you have a child who's meant to have an IQ of a certain amount and yours and the other person has the IQ of that person, the kid with the lower IQ may have gotten all this preschool and all this training, but at 3rd grade, by the time they reach 3rd grade, it evens out. So if anything, it's more of a socialization skill to that. I'm not saying don't teach your any kids anything, because in the first 3 years of their life, they learn more in the first 3 years of their life than they learn in their entire lives put together. If you think about it, because they're learning a whole new language, they're learning how to do all these other things. So the amount of learning is good, but intelligence-wise, academic-wise, it all evens out about 3rd grade. So I don't know. I think preschool is good for some kids, but I'm not saying you have to put them in preschool. There's some kids that I think are that the parents aren't being good parents and aren't providing them the structure at the school, at home. Those kids I'm really pushing to go to daycare. But most parents are teaching them at home and interacting with the home, so those kids I don't worry about. I think that's the sign that we're done. Danny, is that the sign we're done? Okay. Yeah, if you guys, I really did enjoy talking to you guys. Is there any one last question or anything pressing that wasn't brought up? Yep. Oh.
Well, I did have so many questions, but I was wondering, those are my boys.
Okay.
They are making, my life so hard.
Oh, they're cute.
They are 2 years old and 7 months. They are not talking. They get sick all the time, and they are so picky. They don't sleep, and 2 years and 7 months, I didn't have full night sleep.
Okay.
And I really cannot enjoy being,
Enjoy them. That is tough. I mean, there's a lot to that. I mean, because there are a lot of issues, and what I would recommend is first talking to your doctor and getting maybe a book or something that they recommend to read about it. But really, it's a matter of tough love. It's a matter of you're okay with them crying. You're okay with them not eating. They look like they're growing well. So it's not a matter of that. As far as the speech, if you're really concerned about the speech, the school system should come out and evaluate their speech to see if they qualify for that.
And we have 2 months, but still
they're not advancing. So,
my main most important question is, do they sleep in the same room? And they wake up a lot every hour, every 30 minutes. So do you suggest, to put in?
I would separate them at this point. And the question is, what do you do when they wake up?
Well, usually they wake up, always cry, and I pick them up and to bring them in living room.
See, and that you can't get them out. You have to keep them there, and that's the key. You have to keep them there because that's why they're crying. They want out. They're falling asleep with you in the room. Possibly they're not going to bed on their own. They're going to delay sleep. They probably delay going to sleep a lot. Yeah, so you have to be very consistent, and it's going to take you probably 2-3 months of being very consistent, not ever letting them out of their room, letting them fall asleep on their own, letting them cry. It's a tough thing. But if it's really hard, Monroe-Meyer Institute at University of Nebraska has a sleep specialist there, and he can help you with the sleep hygiene stuff. Okay? Okay, not a problem. Guys, I really enjoyed talking to you. You guys had great questions, and let me tell you, being a parent, I'm telling you, is one of the greatest things. They did a study on women that were on their deathbed that were lucid, that obviously could think, and they asked them what's the one thing they regret most, and the biggest thing they said was not having more children. So I tempt you to even have more toddlers. Okay, I'm challenging you to that. Okay, guys? Thank you so much.